heard a lot about low T and some of the ways to treat it, but how can you tell if you have low T and what are some of the risks? Some very, very important questions, and with all the answers, Dr. Reyna, founder of HealthTexas, is here to give us the insight. Good afternoon, sir.
Hi, Mike. How are you?
Okay, low T, what is it?
Well, I tell you what happens, people talk about this all the time for women. Women go through menopause. Men can do the same thing as well. And it's pretty impressive because the symptoms are pretty remarkable, and they really affect somebody's lifestyle. People can get grumpy, they get grouchy, they have depression, but for the most part, they have very low energy. It's kind of like what happens when you castrate a dog. The dog lays around, does nothing, and gets fat. That's what happens with men. And it really affects them both psychologically and physically.
And a lot of people just say, well, they're just getting old.
I'm getting older now.
Right.
That's the way it's supposed to be.
And that's what happens.
Yeah.
Now, it doesn't happen to everybody, though, right?
No, it doesn't. No, it doesn't. But it's one of those things that people get old because of low testosterone, because when you fix it, they go back to being active and normal and excited about life again. So it really changes. It's a game changer.
And it's not just to keep from being grumpy and tired all the time, but you said there are some serious serious problems that can come from having low T, right?
And this is something that most doctors aren't even aware of. Men who have a very low testosterone, a total testosterone under 300, their risk of dying from all causes is 40% higher. There is more diabetes, there's more high blood pressure, there's more heart disease, there's more cancer, there's more metabolic syndrome. So it affects them in a very significant way. Not only that, but they're much more fragile. They lose muscle mass, they get fat, they can't exercise, and they don't exercise. So it affects them mentally, and it affects them physically.
Okay, and now getting too much testosterone, people think, okay, I'm going to get all hairy and hair on my knuckles and walk around and...
Yeah, and there could be some side effects taking it, but for the most part, when it's done well, there's really no issues with it. And you can have a little elevation of testosterone, not a clinically significant problem. But yeah, if you're an athlete and a bodybuilder and you take...
That's an
entirely different
ball game. In this case, it is dangerous to be
it's
too
controlled.
much on the low side. You just want to get it back up to where it should be.
Get it within a normal range.
So what's the test for it?
It's a blood test. It's very easy. A fasting blood test in the morning. It tells you what the level is, and if it's low, you treat it. We have ways of treating it now that are very effective, very inexpensive. If I were to give somebody a prescription, the prescriptions cost somewhere in the range of $400 a month. But we use, and that's because it's a synthetic made by a drug company. But when we have these things compounded by a compounding pharmacy, and they make them for us, and it's about $40 a month. It's a game changer for $40 a month. It changes people's lives.
And this can either be a shot. You said it can be something that you put under your tongue.
There's pellets, there's shots, there are creams. I like the sublingual preparations because you put it in your mouth, you let it dissolve, you don't swallow it, it goes directly into the blood. So it's like you're taking a shot every day.
And you said since guys don't sit around watching the ball game going, hey, my testosterone's kind of on the low side, most women bring the guys in, right?
It happens a lot where the wives are the ones complaining, my husband's not interested in me anymore.
And speaking of that, you are taking new patients, right?
Absolutely.
Okay, and you have several locations all over town, and for more information and to book an appointment, simple little blood test, just a fasting blood test, like you said, call 210-731-HTMG. That's 210-731-HTMG, or visit their website at healthtexas.org.